Hello. Today we'll talk about vitamin A, why it is important, and what risks may arise from its uncontrolled intake. This episode will be useful for anyone interested in health, nutrition, and how to approach vitamin use correctly. What is vitamin A? Vitamin A is a general term for a group of fat-soluble substances such as retinol, retinoic acid, and also provitamins, for example, beta-carotene. It plays a very important role in maintaining vision, immune defense, cell growth, as well as the health of the skin, mucous epithelium, and reproductive system. The human body cannot produce vitamin A on its own, so it must be obtained externally, through food or in the form of supplements. All of its forms have a similar structure. They are fat-soluble and, unlike water-soluble vitamins, easily accumulate in the human body, especially in the liver and fat tissue. One of the main issues lies in the accumulation of this substance. Its excessive buildup can lead to toxicity. On the other hand, this is also an advantage. If vitamin A stops coming from external sources, deficiency symptoms do not appear immediately. The daily requirement for vitamin A is measured in retinol activity equivalents. The recommended intake varies slightly depending on the source, but all values are approximately similar. Approximate norms. Children, about 300 to 400 micrograms. Adult men, 900 micrograms. Adult women, 700 micrograms. Pregnant and breastfeeding women, up to 1,300 micrograms. Why is vitamin A so important? First and foremost, vision. Vitamin A is involved in the synthesis of rhodopsin, a light-sensitive pigment essential for twilight vision. This is why a deficiency can lead to night blindness, impaired vision in low-light conditions. In addition, vitamin A is essential for normal cell division, maintaining the integrity of the skin and mucous membranes, the body's resistance to infections, antioxidant protection, proper functioning of the reproductive system. Excess vitamin A is being identified more frequently in recent times, although it is still considered a relatively rare condition. Believe me, vitamin A is not the kind of vitamin you should experiment with. Its excess is toxic. This condition can occur when taking medicinal forms of vitamin A or retinoids for therapeutic purposes, or even for preventive use, meaning tablet forms. Surprisingly, toxicity can occur both after oral intake, that is, by mouth, for example, in tablet form, and with topical use, such as in the form of ointments. An excess of vitamin A in the body is called hypervitaminosis. Hypervitaminosis A is a condition in which an excessive amount of this vitamin accumulates in the body. It is usually associated with prolonged intake of vitamin supplements without medical supervision, IDS, without checking your blood level and consulting a doctor, treatment with retinoid medications, most often for acne or psoriasis, excessive consumption of animal liver, such as bear or cod liver. In adults, chronic toxicity can develop when taking 10 to 20 milligrams of retinol daily over the course of several months. For children, dangerous doses are significantly lower. Acute toxicity can occur after a single dose of 200 to 300 milligrams, although there are reports of cases at even lower doses. Symptoms of hypervitaminosis. Symptoms may develop gradually in the chronic form or suddenly in the acute form. Nausea, vomiting, loss of appetite, headaches, irritability, drowsiness, dry skin, peeling, cracked lips, brittle nails, hair loss, joint and bone pain. These symptoms are quite common. However, a more dangerous symptom can also occur: intracranial hypertension. This is an increase in intracranial pressure, and the symptom is characterized by headache, blurred vision, and confusion. The liver is, of course, also affected. The point is that there are several mechanisms of liver damage. 1. Due to the direct hepatotoxicity of retinol. 2. Due to elevated triglyceride levels in the blood. In pregnant women, an excess of retinol can cause congenital abnormalities in the fetus. The use of synthetic retinoids is especially dangerous. They must never be taken during pregnancy without medical supervision. The good news: if hypervitaminosis is detected in time and the source of vitamin A is eliminated, the symptoms are reversible. Vitamin A deficiency. The most well-known and reliable symptom of vitamin A deficiency is impaired vision, also known as night blindness, a decrease in visual acuity specifically in low-light conditions. Dry eyes and xerophthalmia may also occur. An increased frequency of colds and viral infections may occur due to damage to the bronchial epithelium. Your skin may become keratinized, that is, rough and coarse. Problems in the genitourinary system may also appear, such as a reduced sperm count, along with damage to the intestinal tract and nervous system. In severe cases, deficiency can lead to irreversible eye damage and even blindness. Vitamin A deficiency is relatively rare in developed countries. This mainly occurs due to chronic gastrointestinal diseases such as Crohn's disease, celiac disease, and pancreatitis, as well as liver and biliary tract diseases. This is referred to as secondary deficiency. Primary deficiency develops due to various diets low in vegetables and meat, or as a result of malnutrition, which is typical for developing countries. Where is vitamin A found? Vitamin A enters the body from two types of sources. -1. Animal products, retinol. Liver, especially cod, beef, and chicken. Eggs, yolk. Butter, cheese. Fatty fish. Milk. Plant-based products, carotenoids. Carrots, spinach, sweet potatoes, pumpkin, red bell pepper, mangoes, papayas, apricots. The brighter and more intense the color of fruits and vegetables, the more carotenoids they contain. Important, to improve the absorption of plant-based forms of vitamin A, it is recommended to consume them with a source of fat, for example, with olive oil or sour cream. Vitamin A of animal origin has significantly higher bioavailability compared to that from plant-based sources. In other words, animal-derived vitamin A is absorbed by the body much faster and in greater amounts. It's important to keep in mind that about 50% of vitamin A is lost during heat treatment. Conclusion. So, vitamin A is one of the most important vitamins, but it requires a conscious and informed approach. Its deficiency can impair vision, immunity, and the health of the skin and mucous membranes. Its excess can cause serious harm, especially when taking synthetic forms. Vitamin A deficiency can be subclinical, meaning it may not show symptoms, but that doesn't mean you can take it without control. A simple rule: don't prescribe yourself vitamins just in case. Always consult a doctor, especially if you are pregnant, breastfeeding, or have chronic health conditions. The best way to get vitamin A is through a varied diet. Include vegetables, fruits, dairy products, and a bit of liver, and your body will receive everything it needs. Subscribe so you don't miss new episodes about health and nutrition. Thank you for watching.